One of the common knee conditions that a lot of people injure playing sports, whether it's a pickleball player or a soccer player, is the meniscus. The meniscus is a specialized cartilage in between the femur and the tibia. It acts like a shock absorber that really protects our cartilage, but it is frequently injured. There's different tear patterns that dictate how we treat this, some of which require surgery to best manage, and others can be treated without surgery. Recovery from a meniscus surgery will vary depending on if it's a meniscus repair. Sometimes those take a little bit longer to get better from because there's periods of protection that patients need to go through, and then other surgeries are weight bearing as tolerated and getting better within a 4 to 6 week period. But it's a very common injury, very commonly treated condition in sports medicine. Those patients that do end up requiring surgery for their meniscus tear, we usually do this through what's called an arthroscopy, which is an outpatient surgery. We do it with tiny incisions through the front part of the knee. We can go in with a camera and look at the meniscus. We can then assess the tear pattern, which will often dictate whether it's a repair or just removing the torn areas. Depending on which procedure is done, whether that be a repair or just trimming out the torn area, most patients are in the operating room for 45 minutes to an hour. The recovery is dependent on whether it's a repair or just removing the torn area. And then in terms of recovery after a meniscus surgery, a repair, patients are in a brace typically. Their weight bearing may be protected, meaning they may need crutches for a period of time to allow that tissue to heal. Patients will be in physical therapy during that healing period to keep range of motion and then to slowly build strength. Recovering from the surgery is different than getting back into sports, and that's often a conversation we have with patients to understand the length of time that it takes to recover. Most patients will be back to sports within 4 to 6 months of a repair, and most patients who have a meniscectomy, which is just the removal of the torn tissue, can be back as early as 6 weeks.